They called her the old nurse, like she was furniture that had stopped being useful years ago. Margaret Walsh arrived at St. Michael's Cardiac Unit at 6:47 a.m. on a Tuesday in March, her badge clipped to the same faded scrub she'd worn since the hospital switched to the blue color scheme in 2013. Her graying hair, pulled back in a bun so tight it seemed to stretch the skin at her temples, marked her as someone who'd given up on vanity approximately a decade ago. The younger nurses didn't know her name half the time. They just said it, the old nurse, when they needed someone to cover a double, or to take the difficult patients, or to sit with the dying when their own families didn't show. She didn't mind. Names carried weight. Names invited questions. The unit office smelled like the same burnt coffee that had been warming in the pot since the night shift, acrid and slightly chemical, and Margaret poured a cup without tasting it, moving through the fluorescent-lit space like someone who knew exactly where every cabinet, every chart, every requisition form would be waiting. 11 years at St. Michael's. 11 years of noting which floor nurses could handle cardiac emergencies and which ones froze at the sound of a flatlining monitor. 11 years of understanding, without anyone telling her, that most hospitals run on the competence of people nobody pays attention to. She set her coffee on the corner of the administrative desk and opened the supply requisition file for the fourth-floor unit, her reading glasses sliding down her nose as she began to cross-reference the invoices. The handwriting was meticulous, her own, dated carefully, itemized down to the penny. Surgical sutures. Size 4.0 polypropylene. 20 boxes. The vendor invoice claimed they'd cost $847 per box. Margaret had worked medical supply requisitions long enough to know that number was wrong. 40% wrong. Maybe more. She made a note in the margin, 3 short lines of careful script, and moved to the next form. The bear hugger warming blankets. The EKG lead sets. The chest tube insertion kits. Every single item carried the same invisible tax, the same mathematics of overbilling that didn't quite cross the line into flagrant fraud but certainly waltzed right up to it and smiled. Someone was taking money. Someone was doing it carefully. Someone believed they wouldn't get caught because they'd buried the inconsistencies in the white noise of hospital operations, in the 1,000 tiny transactions that hummed through the system every single day without anyone actually looking at them. Margaret looked at them. This was the problem, though she didn't know it yet. This was the precise moment the trap was being set, though the trap setter had no idea someone had walked into position to be caught by it. Dr. David Mercer stood in the doorway of the cardiac unit director's office, watching Margaret through the glass partition as she worked. He had the kind of face that photographs well, handsome in a catalog way, with teeth that cost more than most people's cars and a Rolex that caught the fluorescent light and threw it back like a small promise. His shoes were Italian leather, $1,200, and they left faint scuff marks on the linoleum as he shifted his weight, calculating. Mercer had cultivated his lucrative arrangement with Precision Medical Supply for 6 years. 6 years of signed documents he kept in a private safe, 6 years of invoices that traced a careful path between legitimate overcharging and outright felony. 6 years of quarterly deposits into an account in Grand Cayman that bore his brother-in-law's name. 6 years of conversations held in parking lots and encrypted messages and the kind of understanding that develops between men who have decided together that the rules were written for other people. And then Margaret Walsh had started asking questions about the numbers. He watched her turn a page. Her hands were the hands of someone who'd done something besides review paperwork. The knuckles were calloused. The right index and middle fingers carried permanent indentations from holding a pen or something similar, a surgical tool, maybe. Her wrists showed the pale lines of someone who'd worn a watch constantly, then removed it, and the skin had stayed lighter underneath. Mercer didn't see a problem in that. He saw an aging floor nurse who'd developed the quirk of micromanaging supply forms to feel important. He didn't see the way her eyes tracked across the documents with the precision of someone trained to spot anomalies. He didn't see the faded unit patch she'd sewn into her jacket lining 2 months ago, when she thought no one was looking, the insignia of the 3rd Battalion, 5th Marines, Dark Horse Company, the unit that had broken the siege at Fallujah in 2005 with exactly 17 soldiers, 3 of whom shouldn't have made it out alive. He didn't know that Margaret had kept those soldiers breathing with nothing but field supplies, a combat knife, and a memory of training that had never been officially recorded because the operation had gone black the moment it started. He didn't know that she'd earned a Silver Star for that day, and another one 5 years later in Tikrit, and that both medals were still in a shoe box in her apartment because accepting them would have required paperwork that would have contradicted every official document claiming she'd been honorably discharged in 2003 with a medical discharge for a lower back injury that had never actually happened. He didn't know any of that. He just knew she was becoming difficult. Margaret moved through the supply files with the steady, unremarkable rhythm of someone doing her job correctly. The fourth-floor cardiac unit had been her assignment since 2013, when the then-director had promoted her to senior floor nurse, and she'd immediately declined the title and the pay raise, choosing instead to keep the position's responsibilities with the salary of a standard RN. The younger nurses had been confused by this decision. The older ones had understood immediately. She didn't want the visibility that came with being officially in charge. She wanted to work. That was all she'd ever wanted. To work well, precisely, without anyone paying too much attention to the fact that she was doing it. The morning rounds began at 7. Margaret clipped her badge to her scrub pocket, left her reading glasses on the desk, and moved into the unit corridor. The hallway smelled like the particular combination of antiseptic and human vulnerability that every hospital carries, the scent of a place where people come to heal and sometimes come to die. The linoleum was worn smooth beneath her shoes, worn down by the accumulated steps of 11 years. She knew every scuff mark, every place where the floor had buckled slightly from water damage, every room where the light switches had been installed at slightly different heights because renovations in 1997 hadn't quite matched the blueprint from 1987. Room for 47 was the newest post-op admission. Colonel James Rivera, 63, Green Beret, retired from active duty but still carrying the military bearing in his shoulders and the particular kind of alertness in his eyes that came from having made decisions that other people's lives depended on. He'd had a triple bypass, complex procedure, technically sound, recovery tracking as expected. His family was with him, a daughter in her 30s sitting in the plastic chair beside the bed, a son somewhere in the Middle East, probably in theater, probably not able to call. Margaret reviewed the monitor settings first, BP holding steady at 118/71, heart rate 67, O2 saturation 98% on room air. Normal. Stable. Good. Morning, Colonel, she said quietly. How's the pain? Manageable, he answered. Been worse. For words. He meant it. The kind of man who'd undergone cardiac surgery and rated it below things he'd experienced before. Margaret adjusted the 4-bag saline, running at 150 milliliters per hour, exactly as ordered, and made a note on his chart in her small, precise handwriting. 7 a.m. medication administration, cardiac protocol, post-op day 2, vital stable, patient alert and oriented times 4, surgical sites clean and dry, no complications noted. The daughter watched her work with the intensity of people who love someone recently broken. Margaret had learned, over 11 years, not to look directly at people who were afraid of losing someone. Their eyes were too honest. So she looked at the monitors, at the 4 lines, at the surgical dressings, and let her competence do the speaking. By the time she finished, the daughter had relaxed just slightly, understanding without being told that Margaret Walsh knew what she was doing. Call Light if you need anything, Margaret said. I'm here until 3. She moved to room for 48. Then room for 49. The routine was liturgical, repeated hundreds of times until her hands knew the work and her eyes could read the monitors like text. This was what she did. This was who she'd become. Not the captain. Not the one who'd done the things in Tikrit that still woke her at 2 in the morning with her hands shaking. Just Margaret. Just a nurse. Just the old one who worked the cardiac unit and never asked for anything and never caused problems. And that was the story she was telling herself right up until the moment she turned a corner on the 4th floor and found Dr. Mercer standing in the medication room, holding one of her supply requisition forms, his face arranged in an expression of polite concern that didn't reach his eyes. We need to talk, he said, and closed the door behind her, "about your attention to detail." "Just a nurse," Dr. Mercer said, and the words landed like stones in still water. Margaret stood in room for 47 with her medication cart, the 4 bags suspended in her hands, when he entered without knocking, a choreography he'd perfected over 18 months, always catching her mid-task, always choosing his audience. Mrs. Rivera sat beside her husband's bed, her daughter pressed against the window, rain streaking the glass behind them. The colonel's monitors beat their steady rhythm, oblivious to what was about to happen. "Your medication administration was logged 14 minutes late," Mercer announced, his voice pitched loud enough to travel down the hallway to ensure the nurse's station caught every word. His posture was surgical, chest forward, chin elevated, the bearing of someone accustomed to people nodding before he finished sentences. "In cardiac post-op, that's not sloppy, Nurse Walsh. That's dangerous." Margaret's jaw tightened imperceptibly. Her hands continued their work, documenting vitals, checking the drip rate, her movements the same steady rhythm they'd maintained for 11 years at St. Michael's. The pen didn't shake. Her breathing didn't change. She'd trained herself in Tikrit to metabolize fear into focus, to keep her hand steady when everything else wanted to fracture. "The colonel's rhythm was irregular," she said, her voice measured and even. "I completed a full assessment before administering the digoxin. The delay was documented in his chart. I don't need excuses from someone coasting toward retirement." Mercer cut her off, turning slightly so his dismissal could be witnessed. His eyes flicked toward Mrs. Rivera, calculating. That was the real target, not Margaret's competence, but the family's confidence. Standards exist for a reason. Try to meet them. He turned to the colonel's wife with an apologetic smile, the kind of smile that came from confidence in institutional power, the smile of a man who knew the hospital's hierarchy started with him. "We have more experienced staff if you'd prefer," he said, extending his hand like an offer of rescue. Mrs. Rivera's face had already begun to close, that particular tightening that Margaret recognized from 100 interactions with families who'd just been told to doubt her. Margaret signed the chart. Dated the entry. Completed each notation with the precision that had kept Colonel Rivera alive through his sternotomy, through his first post-op night, through the complications that hadn't yet announced themselves. She tucked the blanket around his shoulders with the same gentleness she extended to every patient, the same hands that had held compressed thoracic cavities in field hospitals when there were no surgeons for 50 kilometers. Mercer watched her finish, watching for a tremor, a crack, anything he could weaponize. He found nothing and left anyway, his work already complete. The colonel's eyes followed her as she turned to leave, something shifting in his expression, a recognition that moved faster than words. But she didn't meet his gaze. Not yet. The break room on the 4th floor smelled like the collective lunches of people who microwaved fish and reheated coffee. Margaret pushed through the swinging door at 1,245 hours with her turkey sandwich, the same Tuesday meal she'd brought every Tuesday for 6 years. 4 nurses sat at the corner table, Casey, Rodriguez, Jennifer, and Huang amid conversation about the new respiratory protocols, their voices overlapping in the particular rhythm of people who work together long enough to finish each other's sentences. They saw her enter. The conversation didn't pause. It stopped. That was the distinction that mattered, a cessation, not a transition. Casey collected her phone first, the motion deliberate. Rodriguez followed, sliding her chair back with a scrape against linoleum that carried accusation. Jennifer stared at the table, then stood without comment. Huang came last, his neck flushing with something that might have been shame or fear, and Margaret couldn't determine which and wouldn't ask. They filed out in silence, the fluorescent lights humming their mechanical drone above, the refrigerator compressor cycling on with a sound like a living thing breathing. Margaret sat in the chair they'd abandoned, the seat still warm. She opened her lunch. Turkey, mayonnaise, lettuce on wheat bread. She'd made it at home at 0600 that morning, standing in her kitchen in the pre-dawn dark, her hands moving through the motions while her mind tracked the implications of a formal write-up, of Mercer's reassignment orders, of a hospital where silence could be weaponized as effectively as any blade. She chewed. Swallowed. Continued eating mechanically, methodically, her eyes fixed on the wall calendar that showed November date someone had crossed off with red pen. 3 weeks of boxes crossed out. 3 weeks of this. She finished every bite, wiped the table clean, deposited her empty container in the trash. Her hands didn't shake. She'd trained them better than that. The unit board was posted at the entrance to the cardiac floor, a corkboard covered in scheduling announcements, continuing education requirements, and mandatory compliance reminders. Margaret saw it as she approached from the stairwell, saw the new printout already yellowing slightly at the edges, saw the nurses gathered around it with their phones ready to document, the modern equivalent of word of mouth, getting it on the record, building a permanent file. She walked to the board. Read it without moving, without allowing her face to reflect the letters and words. Walsh, M. Insubordination and procedural violations. Failure to follow chain of command regarding supply concerns. Medication timing discrepancies. Termination review pending. 3 seconds. That's what she allowed herself, 3 seconds of staring while her mind catalogued the legal language, the strategic phrasing, the care Mercer had taken to make sure none of it was technically false. She had questioned his supply procurement. The medication had been 14 minutes late, even if the delay was medically justified. The chain of command violation, that was brilliant, actually. She should have reported her concerns to him directly instead of examining the records independently. He'd made her investigation into a protocol breach. The nurses dispersed when she approached, peeling away like drops of water from hot metal. Patel offered a sympathetic look that felt worse than hostility. Marcus, the clinical coordinator, suddenly needed to check the supply room. The silence followed her like a stain that wouldn't wash out. Margaret walked to the supply closet at the end of the hall, the place where staff restocked their carts between patient rounds. It was narrow, barely wide enough for one person, with metal shelving stretching from floor to ceiling, boxes of gauze and tape and wound dressings organized by item code. She pulled the door shut and stood motionless among the supplies. The fluorescent strips hummed above her head. Somewhere down the hall, a monitor beeped. Somewhere in the stairwell, footsteps echoed, someone else moving through the hospital, someone else with a normal shift, someone else whose entire career wasn't being systematically dismantled by a man who decided she knew too much. Margaret pressed her forehead against the cold metal shelving. It was industrial, utilitarian, the kind of surface that had been touched by thousands of hands across decades. She breathed once. Twice. The metal was cool against her skin, grounding her, pulling her back from the edge of something she couldn't afford to examine too closely. She thought of Tikrit. She thought of a night when everything went black, when her unit was scattered across an objective that had been compromised before they arrived, when she'd moved through darkness for 43 hours straight pulling people to extraction points, field dressing wounds, calling in air support with a radio that kept cutting out. She thought of the last person she'd carried, a lance corporal with a collapsed lung who told her his mother was waiting for him in San Diego, who'd stopped breathing 2 minutes before the Black Hawk landed, whose name she'd never spoken aloud again. That had felt impossible to survive. And she had survived it. She'd come home. She'd buried her past in a shoe box. She'd put on scrubs and spent 11 years asking nothing of the world except to be left alone. She opened her eyes and straightened. The supply closet smelled like cardboard and antiseptic and the faint petroleum undertone of sterile packaging. She pulled an inventory list from the shelf clip and began restocking her cart with methodical precision, for bags, saline flushes, sterile dressings, each item catalogued, each motion efficient. Her hands didn't shake. Her composure held like a structure she'd built so carefully that it could withstand anything except the possibility of its own collapse. But that wasn't the worst part. The worst part was that she understood exactly what Mercer had done. He hadn't just attacked her competence. He'd constructed a narrative that would survive any investigation, any complaint, any question she might raise. He'd moved from mockery to strategy, from public humiliation to institutional assault, and he'd done it so cleanly that she could almost admire the architecture of it. Almost. She checked her watch. 1,400 hours. She had 6 more hours on her shift. 6 more hours to document Colonel Rivera's recovery, to watch his monitors, to catch the irregularities that were already beginning to manifest in his chest tube output, the increased sanguineous drainage that suggested something beneath his sternotomy was deteriorating. She'd noticed it during evening rounds yesterday, had flagged it in her notes, had requested Mercer review the readings. He dismissed her concerns with 4 words, "You're not a physician, Walsh." She closed the supply closet door and returned to work. The morning of day 3, Margaret was making rounds on the cardiac floor when she noticed the numbers. Not obvious numbers. Small numbers. The kind that whisper before they scream. Colonel Rivera's chest tube output had been running pale gold yesterday, serous fluid, the body's natural weeping after trauma. Today it was darker. Thicker. By 9:51 a.m., the drainage had shifted to a rust-colored amber that made her pause mid-assessment, her trained eye reading the subtle story written in the tube's transparent chamber. She'd performed field thoracotomies in Tikrit with a combat knife in her hands and artillery screaming overhead. She knew what blood looked like when something vital was tearing from the inside out. His CVP line was tracking wrong too. Central venous pressure should sit between 2 and 8 millimeters of mercury. Rivera's had been stable at 4.2 yesterday. This morning it sat at 6.8 and climbing. His heart was working harder to push against pressure that shouldn't be there. Fluid accumulation. Pericardial effusion building in the sac surrounding his heart like an accusation. Margaret pulled his chart and began documenting with the precision of someone whose observations had once meant the difference between 17 soldiers coming home or coming home in flag-draped boxes. Post-op day 3:09 for 7 hours. Chest tube output increased to approximately 120 milliliters over 8 hours, color shifted from serous to serosanguinous. CVP elevated to 6.8, up from 4.2 baseline. Patient reports mild dyspnea. Recommend immediate evaluation for possible sternotomy complication, possible tamponade developing. She printed the documentation, her hand steady as surgical instruments, and walked toward Dr. Mercer's office on the 3rd floor. The elevator hummed its mechanical song as it climbed. The fluorescent lights buzzed their endless static hum overhead. Everything was normal. Everything was urgent. Margaret had learned long ago that the two could exist in the same moment. She knocked on Mercer's office door at 10:03 a.m. He was on the phone, his leather chair angled away from her, his voice carrying the tone of someone discussing something that mattered to him. His brother-in-law worked in hospital administration. His brother-in-law controlled the medical supply contracts. His brother-in-law had made certain that questions about billing practices got filtered through the right channels first. Mercer had institutional armor that most doctors never dreamed of wearing. "Doctor," Margaret said, "Colonel Rivera's pressures are trending dangerously. I need you to review his post-op assessment." Mercer swiveled his chair without hanging up his phone. His eyes moved across her face like a scanner reading something it had already determined was worthless. "You're not assigned to Rivera anymore, Walsh. I reassigned your patient load yesterday. His sternotomy sutures might be failing. His CVP is at." "Might be." Mercer's smile appeared like a weapon being drawn. "That's not diagnosis, Walsh. That's speculation. That's exactly the kind of pattern-seeking behavior that led to your write-up." He turned his chair back to face his desk, the conversation already over in his mind. "I'll check on him myself during rounds. You have patients in for 12 and for 16. Focus on the ones you're actually qualified to oversee." Margaret stood in his doorway for 3 seconds. Exactly 3. In those 3 seconds she calculated the deterioration rate, ran the numbers forward, mapped the timeline. 72 hours of clinical observation said the colonel would crash sometime between 1100 and 1300 hours. Her captain's instinct, the one that had kept her alive in Tikrit, screamed that waiting for Mercer's rounds was already too late. But she was a nurse in a civilian hospital in Savannah, not a field medic in a combat zone. She nodded once and turned back toward the nursing station. By 10:48 a.m., Margaret had been reassigned. The changes appeared in the computer system with the efficiency of a scalpel, a few keystrokes and her name vanished from Rivera's care team. No verbal conversation with her charge nurse. No notation on the unit board. Just a quiet administrative deletion that ensured her clinical documentation would never reach the attending physician's eyes, that her observations would be filed in a chart she was no longer credentialed to access, that her warnings would exist in the electronic void, visible only to her, invisible to everyone else. She understood what Mercer was doing. She'd seen the same tactical maneuver used in military logistics: isolate the observer, eliminate the data stream, ensure the decision-maker never hears the warning. But in Tikrit there had been a command structure, protocols for overriding orders when lives were at stake. In St. Michael's there was only policy, and policy belonged to Dr. Mercer. The morning stretched on like a held breath. Margaret checked on her reassigned patients, a post-gallbladder removal in for 12, a woman 3 days out from mitral valve repair in for 16. Both stable. Both not crashing. She moved through the hours with the mechanical precision of someone whose body was present while her mind calculated the widening gap between what she knew and what anyone with authority would believe. At 11:23 a.m. she passed Rivera's room and saw Mercer doing rounds, his white coat crisp as a military dress uniform, his movements confident and assured. He spent approximately 4 minutes with the colonel. He did not look at the chest tube. He did not check the CVP line. He wrote something in the chart with a fountain pen, actual fountain pen, the kind that cost more than Margaret's car payment, and moved on to the next room. By 11:58 a.m., Margaret's hands were beginning to understand something her mind had already calculated. The trembling wasn't fear. It was restraint. She was holding herself back from something that would cost her a license she'd earned 23 years ago, cost her the credibility Mercer was systematically vaporizing, cost her whatever remained of Margaret Walsh as she existed in this hospital's records. Then the alarm sounded. Not the soft recurring beep of a standard monitor. The urgent escalating wail of a code notification, the sound that made every medical professional's nervous system respond like a triggered reflex. Room for 47. The cardiac floor. 12:04 p.m. Margaret was moving before her brain processed the impulse, muscle memory taking over, the same instinct that had driven her forward in Tikrit, that had kept her running toward chaos instead of away from it. The hallway filled with staff converging like ants responding to a colony alarm. Code team was 3 minutes out from the cardiac ICU. Respiratory was in transit. Surgery was being notified. She reached the room and saw what Mercer's 4-minute assessment had missed. Colonel Rivera's chest was heaving with effort, the sternum visibly separating under the pressure of what was building inside. The chest tube had filled with bright blood, arterial red, not venous burgundy. His lips were taking on the dusky pallor of someone whose lungs couldn't pull oxygen fast enough, whose heart was being slowly crushed by the fluid accumulating in the pericardial sac. Margaret moved toward the code cart, her mind already running the timeline. 30 seconds to significant tamponade. 60 seconds to full arrest. Chest CT would take 4 minutes minimum. Transfer to the OR would take another 8. The colonel would be dead before they got him to the surgical suite. Code teams on approach, someone called out. ETA 3 minutes. Dr. Mercer appeared in the doorway, and Margaret saw the calculation shift in his eyes. Not concern. Not urgency. Something sharper and colder, the realization that this patient's death, during Margaret's shift, with her most recent documented concerns in the chart, would be the perfect conclusion to her professional dismantling. He moved into the room with unhurried precision. Get a 14-gauge angiocath, he said to the charge nurse. We'll need an emergent bedside pericardiocentesis once we stabilize his pressure. Margaret stepped forward. His sternotomy is failing. You're not assigned to this patient anymore, Walsh. Step back. The sutures are separating. His chest cavity is filling with. I said step back. Mercer's voice carried the weight of institutional authority. He looked at security, who were standing by the doorway, already present, already called, already waiting for her. Nurse Walsh is no longer credentialed for cardiac patients pending her disciplinary review. Remove her from the room. The two security guards moved toward her, their presence suddenly the most immediate reality in the space. Margaret could have resisted. She'd been trained in ways that would have dropped both of them in approximately 4 seconds. But that choice lived in a different world, in a different uniform, in a past that was supposed to be buried. She raised her hands and stepped back. Her recent pattern of inaccurate assessments is why we're in this situation, Mercer continued, speaking to the code team as they entered the room, his narrative already written, already airtight. Don't let her coaching influence your decisions. The security guard's hand was on her arm, guiding her toward the door. Through the glass partition, Margaret could see Mercer positioning the pericardiocentesis needle, see his hands move with the confidence of someone who'd never been questioned, who'd never been forced to choose between protocol and catastrophe. She could calculate it precisely. Without the pericardiocentesis, without relief of the building pressure, the colonel would arrest in approximately 90 seconds. With the procedure, if Mercer found the fluid and evacuated it successfully, another 5 to 7 minutes. Surgery in the OR, once he got there, could repair the sternal rupture. Maybe. If he made it through the pericardiocentesis without the needle triggering a lethal arrhythmia. Mercer's hands moved with surgical precision. The needle advanced through skin and tissue toward the pericardial sac. If he hit the fluid, he'd know immediately, the sudden give as needle penetrated membrane, the immediate relief as fluid drained and pressure released. He was going to miss. Margaret saw it in the angle of the needle, in the trajectory that was diverging by fractions of a centimeter from the target. His approach was textbook perfect. His anatomy was slightly off, or the patient was positioned differently than the needle's trajectory predicted, or 1,000 other variables that lived in the gap between theory and emergency. The needle advanced. The pressure reading on the monitor showed no drop. Colonel Rivera's BP was falling, 90/60, then 82/48. His heart rate climbing toward 160, desperate, drowning. The security guard was physically removing her from the room now, his grip professional and immovable. Margaret could have broken the hold. Part of her was screaming to break the hold, to move back into that room, to take the scalpel from the crash cart and do what needed to be done, what she'd done in Tikrit with sand in her teeth and mortars shaking the building, what she knew in her bones had to happen if this man was going to see tomorrow. But she was Margaret Walsh, the old nurse, the woman who'd been humiliated in front of patients and families, who'd been reassigned and documented and systematically stripped of credibility. She was not Captain Margaret Walsh of the Army Medical Corps anymore. That woman was supposed to be gone. Except she was still there. She was standing at the threshold of a hospital room, watching a soldier die from treatable shock because she'd been forced to step back. She drove her elbow into the solar plexus of the security guard holding her arm. The security guard's grip loosened for a fraction of a second. That's all Margaret needed. Her elbow drove backward into his solar plexus with the kind of precision that came from muscle memory, from a decade of training in rooms he'd never been to, against opponents he'd never know about. The sound came first, the soft grunt of air leaving his lungs, then the release. She was moving before his hands dropped, stepping past the code team frozen around the crash cart like statues in a museum of hesitation. Colonel Rivera's monitor screamed. Flat line. Not quite. The line jumped erratically, a heart trying to beat through something that shouldn't be there, blood filling the pericardial sac, pressure building around his heart like a vice tightening one turn every 10 seconds. She knew the math. 3 more minutes of this and he was dead. 2 if Mercer's angle was as wrong as she'd seen from the doorway. The needle he'd used for pericardiocentesis had gone in at 45 degrees when it should have been 30, missing the fluid pocket entirely, pushing the tamponade deeper instead of releasing it. Margaret grabbed the scalpel from the crash cart without asking. The blade caught the fluorescent light and threw it back like a mirror. Dr. Mercer's voice came, sharp, furious, the voice of a man watching his control evaporate, but she was already cutting. The gown fell away. His sternum was still sutured from the original surgery, the silk still holding, but beneath it was the problem. She positioned the blade at the inferior edge of the sternotomy and pushed through with the controlled aggression of someone who'd reopened a chest in a sandstorm once, with a combat knife because instruments had been buried under concrete dust and blood in Tikrit, in a forward operating base that didn't officially exist, saving a sergeant who was still breathing somewhere on a ranch in Texas because she hadn't hesitated. "Stop her! She's not authorized!" Mercer was shouting now, his composure finally breaking like cheap drywall. But Margaret was already inside. The fourth floor watched through the glass wall. Nurses pressed their faces close, doctors stopped mid-stride, families gripped each other as a woman in blood-soaked scrubs worked inside a man's open chest like she was reading from a textbook written in muscle and suture and the terrible arithmetic of hemorrhage. The security guard was struggling to stand, one hand on his ribs, the other reaching for his radio. Nobody was going to help him. They were all watching her hands. Margaret's fingers found the bleeding vessel, the suture line had failed exactly where she'd predicted, the silk thread separated at the junction, blood pouring into the pericardial sac like a tap that wouldn't shut off. She compressed it with her bare fingers, feeling the warmth of his blood, the rhythm of his failing heart against the back of her hand. The sensation wasn't new. It was recognition. It was coming home. Clamp. Now. Her voice was different. Lower. Carrying the kind of authority that didn't ask permission. The intern at the Mayo stand moved without thinking, his body obeying something deeper than hospital hierarchy. Suction. I need to see the suture line. The nurse handling the suction unit brought it in fast, steadying her hand as Margaret compressed the bleeding point. The visibility improved in real time. There. The failed suture. The artery that was going to kill him in 90 seconds if she didn't fix it right now. Get me vascular. And a 4.0 proline, double needle. She heard herself saying the words and understood that this was the moment everything changed. The moment she stopped being the old nurse that nobody knew, the one who pushed meds late and got written up for questioning paperwork. This was the moment the mask cracked. The code team moved like they'd been trained for this their whole lives. The 4.0 suture appeared in her other hand, not her primary hand, the one still maintaining compression in his chest, and her fingers worked the double needle through the artery walls with movements that belonged to someone who'd done this under fire, who'd done this when the building was coming down around her and the only thing that mattered was the soldier in front of her and the fact that he was going to go home because she wouldn't accept the alternative. His rhythm returned. She felt it first, the pulse under her compressing fingers, the sudden purposeful contraction of the left ventricle, the sound of the monitor climbing from flatline to something that resembled a heartbeat. 70. 80. The color was coming back into his face, the gray receding, replaced by the flush of oxygenated blood. His pupils were still reactive. Still here. The surgical backup team burst through the doors at a run, the real surgeons, the ones with the credentials hanging on the wall, and took over without a word. Margaret stepped back. Her scrubs were soaked through. There was blood on her face, she realized. She must have brushed her cheek at some point, left a mark there like a medal no one would understand. She watched the surgical team perform the closure with the methodical precision of people who got paid to do this, and felt nothing. Not relief. Not satisfaction. Just the peculiar emptiness that came after, when the adrenaline released all at once and left her standing in its absence. She was escorted from the room 90 minutes later, after Rivera was stable, after the surgical team had confirmed what she already knew, that the suture line would hold, that his cardiac output was climbing, that he was going to live because she'd forced her way through a doorway and done what nobody in this building knew how to do. The security office was windowless and fluorescent lit, the air smelling like burnt coffee and the strange artificial ozone that comes from too many electronics in a small space. Dr. Mercer sat across the table with the administrator and the hospital's legal counsel. His composure had returned, had been reconstructed like a wall built back up after an explosion. His voice was controlled, almost gentle, the voice of a man who'd already prepared his narrative, who'd already made the calls that needed making. You performed an unauthorized invasive surgical procedure, he said, reading from a sheet in front of him like he was reciting the weather. You assaulted security staff. A pause. You violated direct orders from a senior physician. The administrator nodded along. The legal counsel was taking notes, pen moving in small careful circles. Margaret said nothing. Her hands were clean now. She'd scrubbed in the bathroom adjacent to the cardiac unit, watched the blood swirl down the drain in pink spirals, but she could still feel the texture of the artery wall beneath her fingers, the weight of the suture needle, the pressure of his failing heart. We have no choice but to terminate your employment, effective immediately, Mercer continued. We will also be reporting you to the State Nursing Board for license revocation. Your assault on hospital security, combined with the procedural violations documented in your personnel file, constitute grounds for surrender of your nursing credentials. Mercer had already made the calls. Margaret understood this with the clarity that came from watching men like him operate. His golf partner sat on the board of nursing. His reassignments had started this morning. The code team that had watched her work were already being shifted to night rotation, their availability as witnesses eliminated. The personnel file in front of them was pristine in its documentation of her destruction, the medication error that Mercer had orchestrated, the write-up for insubordination, the pattern of dangerous recklessness that only he could see. The next hour was procedural. Her badge was deactivated. Security escorted her to her locker. She collected the few things that had ever belonged there: a protein bar, a hair tie, a sweater she'd forgotten about in March. The unit patch was still sewn inside her jacket lining where she'd placed it 11 years ago, the 3rd Special Forces Group insignia that belonged to a woman who'd been ordered to disappear, to burn her records and shed her name and become someone small enough not to cast a shadow. By 3 in the morning, Margaret sat alone in a vinyl booth at the Starlight Diner on Abercorn Street, the coffee in front of her long gone cold, the liquid surface reflecting the harsh fluorescent ceiling lights like a mirror she didn't want to look into. The window beside her was dark, the street outside emptied of everything but rain that came down like applause from an audience she couldn't see. Her hollow-eyed reflection stared back at her from the glass, a woman who'd been burned twice now, whose records had been erased twice, whose name had been stolen twice. Disappearing once was duty. An order from someone in an office that didn't officially exist, her service record incinerated, her captain's bars locked in a shoe box under the bed of an apartment she didn't remember signing the lease for. It was the price of Tikrit. The price of 17 lives extracted under fire, of field surgery with a knife because everything else was destroyed, of coming home to a country that had never acknowledged she'd been gone. Disappearing twice felt like erasure. Like being unmade. Like the cost of keeping her word was finally higher than the cost of breaking it. The faded unit patch slipped from her jacket lining without her noticing, falling silently onto the table beside the creamer and the salt shaker. The emblem she'd sewn there after everything, the 3rd Special Forces Group insignia in dull thread, a ghost insignia for a ghost soldier. It sat there beside her cold coffee like an accusation she had no way to answer. She didn't pick it up. She didn't even look at it. She just sat there in the vinyl booth at 3 a.m., with the rain hammering the parking lot outside and her own reflection staring back at her from the dark window, and wondered if a person could disappear so completely that even they couldn't find their way back. The Pentagon background check triggered Monday morning at 8:27 a.m. when HR processed Margaret's termination paperwork through the standard State Nursing Board submission system. Her classified security clearance flagged through DoD systems like a tripwire, a captain's name buried in discharge documents that should never have been public record. The algorithm caught it. The algorithm always caught it. Within 3 hours, a Marine colonel named Halloway sat in the hospital administrator's office reading from a citation that used words like Valor, extraction under fire, 17 lives, Tikrit. His voice was quiet, the kind of quiet that came from having already seen the worst, and he was halfway through describing a classified operation when Dr. Mercer burst through the door demanding to know why his disciplinary action was being questioned, why the state board was suddenly frozen, why his calls weren't being returned. The colonel looked up. Not angry. Just observant. The way a sniper watches terrain before the shot. Dr. Mercer. Not a greeting. A confirmation. I believe you initiated a fraud investigation into hospital supply chain billing irregularities. Mercer's face went white. Not the white of shame. the white of a man watching his calculated world collapse in real time. That investigation, the colonel continued, was routed through military channels due to Captain Walsh's active security clearance. 48 hours ago, federal auditors completed their preliminary findings. $2.3 million in fraudulent billing over 9 years. 3 shell companies. Your personal accounts. Every inflated invoice documented. The words landed like bullets. Mercer reached for the desk to steady himself. His surgeon's hands trembled, those hands that had signed her termination, that had attempted pericardiocentesis with the wrong needle angle while a man was dying. The hospital settled the class action litigation this morning at 6 a.m., Holloway said. 17 cases where substandard supplies failed during surgical procedures you supervised. Colonel Rivera's near-fatal sternotomy rupture became their flagship exhibit. Your malpractice insurance carrier sent notice of coverage denial at 7:15 a.m. Your medical license is being surrendered as part of a negotiated plea agreement. Federal agents are waiting in the parking lot. Mercer opened his mouth. Nothing came out. The room smelled like antiseptic and career death. The door opened. 2 federal agents in dark suits, expressions flat. One of them read him his rights with the efficiency of men who'd done this 1,000 times before. Mercer's hands, those steady surgical hands, shook as they cuffed him. The sound of metal clicking closed was the sound of a decade of profit vanishing into federal restitution schedules. Margaret wasn't there to see it. She didn't need to be. What happened instead was quieter. A general arrived at St. Michael's on Wednesday afternoon, walked directly to the cardiac unit, and asked the staff to step aside. In the supply room where Margaret had spent 11 years cataloguing fraud, he stood before her with the bearing of a man who'd commanded thousands, and saluted. Fist to chest, the sound like a heartbeat against armor. Captain Walsh, he said. Her rank. Her actual rank. The words felt like crossing back into a body she'd abandoned years ago. The decorations you've carried since Tikrit. The ones in the shoe box in your apartment. We'd like them back. For the record. For the official record. Margaret's jaw tightened. They're yours. The words came out steady. Military. Always were. The Pentagon liaison, a Navy captain with eyes that had assessed 100 classified situations, delivered the new code name with the precision of someone reading coordinates for a strike mission. Nightingale 7. The Army thanks you for your continued discretion. Your teaching position at Walter Reed begins in 60 days. Combat Medicine Curriculum Development. Honorable discharge from black operations. Full pension retroactive. She didn't say yes. She didn't say no. She just nodded once, the way soldiers do when accepting orders they've already committed to executing. The federal agents escorted Mercer out through the main entrance at 3:53 p.m., his face down, his career a smoking crater. The hospital staff watched from the windows. Nobody spoke. The fluorescent lights hummed their mechanical rhythm. 6 months later, Margaret Walsh drove through a Savannah strip mall parking lot on a Saturday afternoon, carrying groceries in canvas bags that bore the weight of ordinary life. Her jacket was cleaned and pressed. The faded unit patch, the 3rd Special Forces Group insignia she'd sewn there after Tikrit, after everything, was stitched securely back inside the lining where it belonged, where no one would see it unless they already knew to look. She saw him through the window of a medical supply van at the loading dock. Dr. Mercer. Stacking boxes. His surgeon's hands pushing cardboard into the van's interior, sweat dark on his company polo shirt in the Georgia heat. The same hands that had signed her termination. The same hands that had failed to save a dying man. Now reduced to logistics. To movement. To the simple mechanical task of stacking supply boxes for minimum wage, his plea agreement having rendered him unhireable anywhere else. Their eyes met for a fraction of a second. His face flashed recognition. Then shame. Then something that might have been pleading, a request for mercy she would never give, for forgiveness that wasn't hers to grant. She didn't slow her stride. Didn't acknowledge him. Didn't break pace or deviate course. She walked past with the same steady competence she'd carried for 30 years, carrying groceries, carrying secrets, carrying the weight of a captain's rank that the world would never know she held. That evening at Walter Reed, Margaret stood before a classroom of young Army medics, 19 of them, ranging in age from 22 to 31, all of them sharp and hungry and terrified in the way soldiers are before they learn what they're actually capable of. Her captain's bars were reinstated for teaching purposes only, displayed on her uniform like the truth finally allowed to exist in daylight. Field medicine isn't about the equipment you have, she began, her voice dropping that octave, the voice that came from Tikrit and black sites and decisions made in seconds that echoed for decades. It's about the lives you refuse to lose. It's about knowing that the person bleeding out in front of you is someone's son, someone's daughter, someone's colonel. And they're worth saving even when every calculation says they're not. A medic raised his hand. Young. Ernest. Is it true you performed a thoracotomy with a combat knife in Tikrit? Margaret's jaw tightened imperceptibly. Her hands remained steady on the podium. I did what the mission required. That's all any of us do. No elaboration. No war stories. Just the truth, economical and clean. After class, alone in her office at Walter Reed, Margaret sat at her desk and touched the unit patch now sewn inside her uniform jacket, the one visible now, the one that said what she actually was. Outside her window, the Potomac River flowed dark and steady toward the sea, carrying everything away. Her phone buzzed. A text message from an unknown number that she somehow knew immediately was from Colonel Rivera's son, recently returned from his own deployment. Colonel Rivera told me everything. Thank you for saving him. Thank you for saving all of us. She typed back 5 words with her thumbs moving slowly, deliberately, each word carrying weight. Just doing my job. Then she added one more word. Always. The screen dimmed. Outside, the evening pressed against the windows like held breath finally releasing. And Margaret Walsh, Captain Margaret Walsh, Nightingale 7, the old nurse who had never been old, who had never stopped being a soldier, sat in the quiet of her office and let herself breathe. True heroism is what you do when the world stops watching. If Margaret's story resonates with you, if you've ever been underestimated and proven everyone wrong, hit that subscribe button and let us know in the comments, have you ever judged someone only to find out you were dead wrong? Tell us your story.